Atypia of undetermined significance (AUS) is a diagnostic category for cases lacking quantitative or qualitative cytological features requiring clear morphologic evidence for diagnosis. Low cellularity and volume are common factors in IDs requiring adequate sample collection and close inspection. Some IDs can be switched to NFM or MAL. Next is the scenarios that can be categorized as AUS. Firstly, when cells don't look normal but also don't clearly show signs of being cancerous or suspicious. Secondly, if there aren't enough cells to examine, or if there are changes, like damage, in the cells that make it hard to judge. Next, sometimes mesothelial cells, normal lining cells, can grow in a way that looks unusual, but it's not clear if it's malignant. Then, if there are many lymphocytes, a type of immune cell, and it's hard to tell if it's just a reaction or something more serious. Lastly, if epithelial cells, another type of cell, appear in fluids but don't show clear signs of being either normal or abnormal. So, this is a few of list cytomorphology criteria for AUS. These are two examples for AUS. The scenarios in which the diagnostic category suspicious for malignancy, SFM, is applied in serous fluid cytopathology. Let's start with the risk of malignancy associated with SFM. Research indicates that the risk is significant, estimated at approximately 82% with a margin of error of plus or minus 4.8%. This high percentage highlights the importance of this classification in cytopathology. When a specimen is labeled as SFM, it signals to clinicians that there is a strong possibility that malignancy may be present, necessitating further investigation. The features are suspicious but not definitive for malignancy. Pathologists identify specific abnormal characteristics that suggest a higher risk than benign conditions but do not meet the criteria for a malignant diagnosis. In comparison to the atypia of undetermined significance category, the degree of suspicios of malignancy is higher. AUS indicates some atypical features, however, SFM suggests a greater concern regarding the possibility of malignancy. This distinction is crucial as it helps prioritize further diagnostic evaluations based on the level of suspicion, suitable for preliminary reports before confirmatory ancillary testing. They can lead to an upgrade to a malignant diagnosis or a downgrade to negative for malignancy. However, if results are non-contributory or insufficient material is available, the diagnosis may remain as SFM. Next is the cytomorphologic criteria for the category suspicious figure for malignancy. The first figure shows the characteristics of substantial nuclear crowding, loss of nuclear polarity and moderate anisonucleosis. Second figure shows the characteristics of prominent nucleoli, increased nuclear to cytoplasmic ratio and anisonucleosis. The third figure shows the characteristics of significant loss of cell polarity, abnormalities of chromatin pattern and variability in nuclear size. This is the two-step process of reporting for atypia of undetermined significance in serous fluid cytopathology. As you can see at this figure, the first step of the process is the identification of the atypical cells where the atypical features can be described and is stated in the preliminary report. Additional lab work is requested as the second step of this process to confirm the case results. Example of additional lab works are creating a cell block, performing clinical tests, or radiological imaging. If these tests support the absence of atypical features, then the final report would be negative for malignancy. And if they indicate malignancy, then the final report would be suspicious or malignant. And if the additional lab work is inconclusive, then the final report would be atypia, where another resampling and clinical correlation is advised. That is the two-step process for AUS. And for the next slide is the two-step process of suspicious for malignancy. Basically, it is just the same as the two-step process for AUS, the difference is just the results for the cell identification and the results for additional lab work. The process is still the same, it includes a two-step process. Now we are going to dive into the reported case for atypia of undetermined significance. The history of the patient is a 55-year-old female with unilateral pleural effusion with the history of breast adenocarcinoma. The sample collected is pleural fluid at the left side of the lung through the thoracentesis. Next, moving on to the cytomorphological findings. From MGG stain, the presence of mesothelial cells observed with characteristics include binucleation, normal NC ratio, and fine chromatin. There are also cytoplasmic vacuolation observed. While in the background, there are presence of cytiocytes, neutrophils, and lymphocytes. From Pap stain, a group of mesothelial cells observed with characteristics include normal NC ratio, smooth nuclear membrane, and fine chromatin. As for the cytoplasm, the characteristics shown are dense cytoplasm and cytoplasmic vacuolation. The preliminary report for this case came out under the category atypia of undetermined significance because cytoplasmic vacuolation was observed. However, the nucleus does not show any abnormal characteristics. Therefore, it is not suitable to be categorized under suspicious of malignancy or negative for malignancy. Additional lab analysis required for further investigation. After the follow-up investigation, the supplementary report findings suggested that the changes seen in the preliminary report are degenerative mesothelial cells. Therefore, the final diagnosis came out as negative for malignancy. Next, we're gonna look at reported case on suspicious for malignancy. Here is the history and macroscopic findings for this case. Next is the cytomorphology findings. In this first field, we can see that there's a markedly atypical mesothelial cells with high NC ratio, prominent nuclei and irregular chromatin distribution. In different field, we can spotted a rare enlarged cell with multinucleation, nuclear irregularity and irregular distribution of the chromatin. In this field, we can find a rare and highly atypical mesothelial cells with high NC ratio and hyperchromasia. This case was reported as suspicious for malignancy. SFM instead of atypia of undetermined significance, AUS due to the degree and characteristics of the cytologic findings, whereby the smears show features of cells that go beyond mild or moderately atypia, and also the described nuclear abnormalities suggest significant concern for malignancy, but not definitive, due to low cellularity in the cell block and inconclusive IHC analysis. And for supplementary report, this case remain as SFM category, due to insufficient diagnostic material for confirmation. Therefore, clinical correlation and resampling is important for more definitive assessment. As for the conclusion for our presentation, here is the difference between atypia and suspicious for malignancy published in the International System for Serous Fluid Cytopathology book. For cytological feature, atypia have subtle changes, bland nuclear morphology, but suspicious have changes more marked with nuclear pleomorphic. For number of cells, suspicious usually have small number of cells compared to apia. For atypia, the differential diagnosis includes reactive changes, benign neoplasm and low-grade malignant neoplasm, but suspicious have high-grade malignant neoplasm. The anticipated clinical outcome for atypia is benign and suspicious is malignant. Lastly, for suggested risk of malignancy, atypia only 10 to 20% but suspicious is higher, which is 80 to 90%. This is the example for atypia and suspicious. For atypia, the NFC ratio is still normal, but for suspicious cell, they have high NFC ratio. Next is nuclear polarity. For apia cell, it still maintains the normal polarity, but suspicious cell, the nuclear has lose its polarity. Next, nuclear overlapping. For atypia, the cells are crowding but not overlapping, but for suspicious, the nuclear overlapping with each other. Last one is chromatin and nucleoli. Atypia have fine chromatin and conspicuous nucleoli, but suspicious has coarse chromatin and prominent nucleoli.